Hi, I'm Dr. Paul Zwiebel. I'm a plastic surgeon here in Denver, Colorado, and I wanted to talk with you today about something we hear about almost every day. The question is, what's the difference between putting breast implants over the muscle or under the muscle? So why would we decide to put the implant in front of the muscle or behind? It really is a matter of customizing the procedure for the individual patient, and there are certain advantages and disadvantages to each approach. When we go in front of the muscle, the procedure itself is much less uncomfortable for the patient. There's really minimal pain during the recovery time, which is a nice advantage. The disadvantage is that we have less of the person's natural tissue. In other words, skin, fat, breast tissue that's covering over the implant. Many women who are having breast implants have a small amount of fat and thin or little breast tissue. So there's little tissue to cover over the implant. That can be important both in terms of appearance as well as feel. So an implant, such as this one, actually does have the ability, when it's sitting inside the body, to have some ripples on its surface. If there's less tissue, fat or breast tissue to cover over the implant, some of those ripples might show up, making it a less desirable outcome from the standpoint of aesthetics and appearance. Another very important aspect is actually the ability to see the edge. So if there's less tissue covering over the implant, there may be a more abrupt or more defined periphery at the implant, which also contributes to a fake look, as opposed to a soft blending look that would occur with a natural breast. When we go behind the muscle, there are a number of advantages. One is that we've got more tissue to cover over the implant. So as I was just discussing, we're much less likely to see the edges of the implant and much less likely to see the rippling. Another big advantage is that as the muscle drapes over the implant, it creates a much softer transition and a much more natural upper slope over the breast. So it has much more of that teardrop appearance and is less likely to look very, very round and fake or artificial. The same is true for the feel. Because there's a little bit more tissue covering over the implant, not only are we not seeing those ripples, we're also much less likely to feel those ripples. There's one more very big advantage in going behind the muscle when we do breast augmentation surgery, and that's that there is a lower capsule contracture rate when we go behind the muscle. Capsule contracture is the process whereby the tissue around the implant scars or gets tight around the implant. That will make the implant feel firm. It will also make it look much more rounded and unnatural. So every day when people bring in pictures and show me the kind of results they don't want to have, they show me pictures of implants where there is a capsule contracture, or in some instances it'll be a slim person who has prepectoral implants in front of the muscle without good soft tissue coverage to really give a much more natural appearance. So for those reasons, going behind the muscle is definitely advantageous, and it's the reason that it's the approach used most of the time by plastic surgeons. The disadvantage in going behind the muscle is that it stretches the muscle, and that causes more pain in the early post-op period. We have techniques for reducing the pain. In my practice, we use a device called an anesthetic pump, and it's a brilliant little device that just drips a little bit of local anesthetic into the area around the implant, so it really numbs up the muscle well during those first few days and makes an enormous difference in post-operative comfort. Well, those are the reasons why you might want to think about having an implant in front or behind the muscle. I'd love to have a chance to talk with you personally during a consultation. So give me a call, 303-470-3400. I look forward to meeting you.